what is antibody-dependent enhancement? So it's one of a spectrum of, it's the easiest one to explain, of a spectrum of effects that can occur with vaccines in which the vaccination actually makes the disease worse. The most notable example is what happened in the 60s with respiratory syncytial virus, a vaccine, a virus which kills young infants with fairly high frequency. And it was slated as being the next pediatric vaccine to be developed after the classical MMR series. And it was found that as they deployed this in the initial clinical trials, that the children, infants that received the vaccine actually died at a much higher frequency than their negative controls that had not received the vaccine. So antibody-dependent enhancement is the vaccinologist's worst nightmare, that the product that you work so hard to create actually causes worse disease. We've found out that the Pfizer vaccine isn't very durable. It doesn't protect for more than about 6 or 7 months.
And how do we know that it provided any protection at all to begin with?
We have the flawed clinical studies. I acknowledge that they're far from perfect, and some might say designed to not be able to detect certain types of adverse events. Specifically, one thing they were not designed to detect is antibody-dependent enhancement. And that's recognized by the FDA, because in the FDA authorization letter for emergency use authorization, they specifically say that the data are not sufficient to rule out antibody-dependent enhancement. It remains a significant risk, and suggested to the vaccine companies that they should do follow-on clinical studies to detect the presence or absence of antibody-dependent enhancement. But they didn't insist that the vaccine companies do that. And the vaccine companies, as near as I can tell from looking at clinicaltrials.gov in the literature, the vaccine companies decided to take a pass and not investigate whether or not ADE would occur. What we do know is the distribution of virus levels, load, whether it's measured by PCR cycles or some measure that correlates more directly to titer, in the vaccinated is at least as high, those vaccinated that have breakthrough infections that become infected, is at least as high as in the unvaccinated. And to my eye, it looks like there's suggestions that there may be a subset of patients that have been vaccinated and infected that have even higher levels of viral replication than are present in the unvaccinated population. That, if that was told true, that would be the smoking gun demonstrating antibody-dependent enhancement.